So we move to our final presenter for today. Elaine Round is currently Group Head of Life Science at BAT, based in Southampton, UK. She's responsible for BAT's Global Science Program for new category products and the Global Science Engagement Plan. Prior to her current role, Elaine was the Global Head of Toxicology at BAT, where she has led a team responsible for safety assessments across product categories. And the title of her presentation is Accelerating Toward a Smokeless Future and Misbeliefs on Nicotine and Tobacco Harm Reduction.
Hi, everyone. My name is Elaine Round, and I'm Group Head of Life Sciences at BAT. And greetings from Southampton, which is where the hub of our R&D is located. I'm looking forward to seeing you all in Warsaw. And as this intro to my presentation for GFN 2024, in this video, I'd like to discuss some commonly held misbeliefs on nicotine and the harms of tobacco. So given the rigorous science we and others have conducted, resulting in data to support the reduced risk potential of smokeless products, ideally there would be widespread support for tobacco harm reduction principles. However, as it stands today, there are strong societal headwinds and misbeliefs about the impact harm reduction efforts can have on public health. In the next few slides, I'll touch on a few of these commonly held misbeliefs. One would expect that because so much is known about the harms of combustible cigarettes, there'd be widespread understanding of where those harms originate. But the first commonly held misbelief is that nicotine causes smoking-related disease. The fact is, it's harmful chemicals created from the burning of tobacco that's by far the greatest cause of smoking-related disease, not the nicotine. And there are still widespread misunderstandings among the most trusted of our advocates for public health, including healthcare providers. However, as you can see here, there are several trusted groups who do have clear information on their websites that accurately describe where the harm from smoking originates, including the National Health Service in the UK, the Food and Drug Administration in the US, and the National Institute of Cancer in France, among a few others. This should be the norm, not the exception. It's imperative that this information is easily accessible and communicated broadly to give context to smokers for why smokeless products are less risky than combustible cigarettes. Fortunately, these agencies help to disprove misbelief number 2, that there is no stakeholder recognition for THR. Health agencies in the UK, the US, and France, among others, not only dispel the information around nicotine, they also provide important and accurate information about the risks of innovative smokeless products relative to smoking, although the language can range from strongly supportive to nearly equivocal. Smokers searching for other alternatives deserve accurate relative risk information to aid their decision-making. Misbelief number 3 is that the conflicting interests of tobacco control and pro-THR groups cannot both be part of the global public health strategy on tobacco. In fact, both groups have important roles to play. With the rise of innovative smokeless products in 2012, when vaping started to gain traction and smokers increasingly embraced tobacco harm reduction, the two movements together have seen cigarette volumes decrease 20% despite population increases, as this data from the WHO on the sale of combustible cigarettes globally shows. With an estimated 1.1 billion smokers and around 100 million consumers of innovative smokeless products globally, working together, we can continue to advance these declines. And with the rise in innovative smokeless product use, there is an absolute need to ensure these products and their marketing don't appeal to youth or those underage. Although there may be a misbelief that all industry participants are intentionally creating and marketing youth-appealing products, in fact, there are both responsible and irresponsible industry participants. Responsible companies like BAT focus on switching current adult smokers who wish to continue using tobacco and nicotine-containing products with information designed for those adults. Our responsible actions range from our corporate position, such as the recent campaign supporting a smoke-free UK by 2030, to the packaging, naming conventions, and even the product attributes and design itself. No one under the legal age to use tobacco and nicotine-containing products should use those products, and responsible industry participants will continue to endeavor to keep products out of their hands. So let's continue the conversation at GFN, and I'll look forward to seeing you in Warsaw soon. Thank you.
Thank you, Elaine, for this presentation. Would you like to add something before we open the floor for questions?
Yeah, thanks, Karin. It's good to see everybody in Warsaw. I will confess that I slightly didn't actually adhere to the whole science lab process, so sorry about that. But so that was meant to be a foundation for just a few points that I wanted to make on and on some ideas on how to accelerate towards a smokeless future. So I'll go ahead and make those 3 points here, and then obviously open the floor for discussion. But so the first point is that adult smokers should have access to reduced risk products everywhere. And so we did an analysis on the markets that we sell products in, which are the top, and we looked at the top 10 populous markets, which are actually the top 10 populous markets, just minus China and Russia. And in that analysis, we saw that only 60% of markets have at least one reduced risk product type available to them. So that's including heated products, vapor products, and nicotine pouch products. So 60% had at least one, only half of them had all. And if you look at it by population, it meant that only 39% of people in those countries actually had access to at least one type of non-combustible product. So the second point I was going to make was that I think it's really important to have a level regulatory playing field to make sure that regulations enable a competitive marketplace for products that meet rigorous safety and manufacturing standards and quality standards. And so alongside that, obviously, is the need for enforcement to ensure that legal products are the only products on the market. Because when we have illicit products on the market, there's a lot of confusion. I think that actually puts harm reduction, it detracts from harm reduction, because there's unclear information to consumers, and then you actually have more risky products out there, which is absolutely not the intent. And then the third point is really about including tobacco harm reduction efforts and the tobacco control efforts as a combined unifying force. I know that's a long way off, but ideally having both of those together and being able to work towards building a smokeless world together in that way. I think we've heard a lot of great discussion over the last couple of days on how to do that. I mean, Cliff Douglas's remarks last night, I think, were really important and a great example of ways to do that. And ideally, having industry be part of that strategy, part of that discussion, and part of that progress as well, I think is also incredibly important. So I think people like Rosalia and Konstantinos, I so much appreciate the efforts that you guys are doing to replicate some of the data that I know that we have produced. So yeah, I was very happy to see that worked out. But I think those efforts are so important, as I know we as industry are really trying to do good science and make sure that we get the best science out there possible. So appreciate your efforts, and also the efforts around identifying science that is not quite as good, and that does, Konstantinos, to your point, create a lot of headlines that unfortunately detract again from harm reduction efforts. So with that, maybe just ending with the importance of continuing to do good research, continuing to do the important studies, and I guess working together as a science community to figure out what those best studies are to ensure that there is acceptance of harm reduction, that there is, and in the end, as the years go on, we will see the proof in the pudding that that is the true harm reduction of these products. So leave it with that. Thanks.
Thank you, Elaine. Do we have questions or comments?
I have. Hello. There was one slide that was showing that there are some products that are not responsible on the market, but I find something misleading because one of the BAT most selling product in Poland is disposables, and disposables was in the not responsible category. So you find your products not responsible?
I think no. If you saw that, that was not the intent. The intent was that some of the products that look like they are very attractive to youth in terms of. But
they are. You have many flavors, like fruity flavors, with some interesting packaging. So you find it not responsible.
I think that flavors are an important part of harm reduction efforts because flavors are also important to adults, as we've just seen from Konstantinos, for example. So I think I recognize there are ways that disposable products that we can work towards reducing that type of product in the marketplace. But I think that at the moment it's hard to ban those kinds of products because they are really helpful for many adults to quit smoking.
In Poland, the ban is coming now for the disposables.
Sorry?
In Poland, the ban is coming now for the disposables.
And they're just going to leave a black market with the products available everywhere, but just without any quality standards or anything. You know, it's a perfect opportunity for them to deliver products that contain more than 2 milliliters, which already exist even in regulated markets. Now imagine in a market that has introduced prohibitions, they're going to easily attract youth, so they will solve nothing. They will create an additional problem. It's 100% the case because we have seen what has happened in all attempts to prohibit products, whether it's a specific product or a product category. In all cases, it resulted in an explosion of the market and just loss of any control from the government in terms of quality, revenues, taxation, accessibility, marketing, and so on. So they just don't learn the lessons. They don't learn the lessons. It's amazing. As for the misconceptions that you mentioned, even among health professionals, the misconceptions are astonishing. I mean, in 2015, we did a study among healthcare professionals in Greece about their perceptions about nicotine, and 80% thought that and responded that nicotine is an important, very important, or extremely important contributor to smoking-related lung cancer. And nicotine is not classified as a carcinogen. Those were healthcare professionals involved in smoking-related disease, so cardiovascular, respiratory, dentists, even pediatricians. That's what they think. They thought that NRT use long-term is not safe, even for medications. I mean, that's the perception.
And I think that's not necessarily specific to Greece either.
No, so we've seen studies in Sweden, in the UK, in the US, everywhere.
The real point is not what are the misconceptions, because we've been knowing them all along. The problem is how to rectify the misconceptions. Is anybody in the room or in the panel have some bright, great suggestions how to overcome this misinfodemic?
Well, I'll just say I really enjoyed Anna's presentation. I thought that was, I mean, I realize that's a lot of information, but I think that kind of information, or at least kind of bringing down some complicated concepts, complicated scientific concepts to kind of a foundation where everybody can understand them, I think is important. Obviously, there's the hard part of getting people to listen, but it's a great question. And we have another question, or maybe we have an answer.
Yeah, a very, very small part of the answer. I think the presentation on it was between cigarette and patches, but it's very interesting also in patches in games. We use it in support groups to explain substitution to people, even with patches. It's the same issue. The thing is, perhaps a 2 cent drive to explanation would be not to repeat the misconception, especially not going to regulators saying some products are attracting you when it's not the subject of the product.
Come on, the WHO tweeted 2 days ago, what smells nice, looks good, and is designed to kill a vape. So the vape is designed to kill. That's the WHO. I mean, what do you expect? I mean, when we meet regulators from Southeast Asia, for example, or any other developing countries which don't have the resources to do any kind of local research or anything, and don't have the time to investigate the issue and research on this matter. I mean, they're going to believe them. They are the holy guidance for them. That's what's happening, you know. The Spanish Cancer Society released a product looking like a disposable, saying cancer flavor, 100% carcinogenic, and they were distributing these samples in delegates of COP10 in Panama. And they were and the secretary of the Ministry of Health of Spain, who is a general practitioner, a doctor, he was tweeting on the 100% carcinogenic e-cigarette. And they don't even care that the Twitter users added a context message, basically telling them that these are fake news, with a citation to the study by Stephens in 2017 in tobacco control, where he measured the lifetime cancer risk potency of these products, and he found that e-cigarettes have a reduced lifetime cancer risk potency of 99.6% compared to smoking. They don't care.
I do think, maybe it is there are the two camps, right? There's the ones that are hard and fast.
This is fanatism, like we are seeing. We are having a football match, and we have two opposing teams, and we have fanatics from one side and the fanatics from the other. No, it's not like that. It shouldn't be like that.
I mean, I think there are some people who are truly ignorant. I don't think healthcare providers want to give the wrong information. I think it may just be they're so busy. There are so many things that come across their desks. That it's not, maybe they learned something in medical school or pharmacy school or something that it stuck with them, and they've never really kind of gone beyond to correct that. So I think there are the truly ignorant groups of people who I think would be receptive to things like continuing education programs by third parties who have the right information. I know Todd's done a lot of that in Canada, who's sitting in the room, which is fantastic. So that kind of information is so important to get to the truly ignorant but open people who want to do the right thing for their patients and want to be accurately informed. And then, of course, there's the people who just won't accept no matter what because they're stuck in beliefs that are not correct. And that one I don't have a great answer for sure. But I do have optimism on the other side of that with those who just don't know.
There's also anxiety among physicians because there are physicians that provide smokers with e-cigarettes or other harmless products.
Mm-hmm.
Did everybody understand? But when they speak up in public, they are whacked like a mole. Mm-hmm. So back in their corner, and they are not. They are afraid to speak up because they will get the wrath of all their colleagues.
Yeah,
and that's a problem. So if there are physicians, for instance, in the UK, that could reach out to international colleagues and help them to try to speak up, that would be a way, perhaps, to have a kind of momentum to create doubt among other decision makers, and that would be perhaps an option.
It's a great point. And I think also, I think there's a role that regulators play as well, that, you know, there are some, not many actually, that are really super openly embracing harm reduction, tobacco harm reduction. I know, like, for the U.S., you know, it's like they do the minimum to cross the line of, okay, yes, we're talking about this in the right way, but then they bury the information on their website, for example. But I think, you know, trusted public groups, I think, also have a responsibility to provide the right information. I actually think overall, I mean, I know things are starting to go the wrong direction in the UK, but the Swap to Stop program, there's a lot of great information on the NHS website. And perhaps that's something that could be done, is to point to those resources, even if the regulators themselves aren't saying, you know, in the country where people are looking, to be able to highlight those resources.
What I think is that we have to be more proactive, because it will not happen by itself. So let's try to find scientists who can talk to other scientists in different countries, physicians who are like pro-harm reduction because of all the good reasons. They can talk to others that they trust, and because you cannot try to change beliefs of really anti-people. We have them enough in the Netherlands, and they are so vocal, and they are influencing others that might have been doubtful or reasonable, but they change, and that's, I guess, we have to try to break the cycle.
You hit the nail there. I think as a respiratory physician, I gave up with my colleagues. However, I'm still an internal medicine doctor, so I have other avenues to explore. And a couple of avenues we explored recently with great satisfaction are diabetes and dentistry. So these are avenues that are, with the professionals, they are extremely receptive of the tobacco harm reduction narrative. And so, yes, I share the hopes, but let's focus all our effort in the right direction, because if we insist trying to convince respiratory physician, oncologists, and cardiologists about tobacco harm reduction, we are really in for a big, surprise, negative surprise.
So thank you for that, and thank you, Elaine, for your presentation.